welcome to my channel. My name is Jennifer and this is week 14, or the beginning of my 4th month of Damon braces, and this is my update. So I'll be doing another update in a couple weeks. I'm also going to have a bonus update tomorrow because tomorrow is my rescheduled dental cleaning appointment, so that's going to be interesting. It will be my first time getting my teeth cleaned with braces on, so that'll be fun. Hopefully it won't be too bad. Let's hope everything is good and I'm not in too much pain. So, this is what my teeth look like week 14, okay? And here is the top. And bottom. So a little bit of change, not too much change. I've just noticed that these teeth right here, this tooth used to sit like behind this tooth. So now it's starting to come out. I'm actually starting to see this side of this tooth, which I haven't seen ever. I've never seen this side of this tooth. So that's kind of a change. Definitely notice a lot of widening up here. This is definitely widened quite a bit. As for the bottom, there's a lot of adjustments. I'm having difficulty with these two teeth. I don't know, can you see, like, it almost looks like this tooth has raised up a little too high. I'm wondering if my next adjustment, if they'll move this bracket. So hopefully they'll move that bracket up just slightly to bring that tooth back down. Because honestly, I feel like, I don't know, it's really hard to tell. Because at the same time, these teeth that are here are just like kind of a little bit lower. I don't know. I'll have to ask them about that because it's just awkward, because every once in a while, either when I'm talking or if I'm eating something, these two teeth will knock up against each other and it's like, sends a shiver. I'm like, it hurts. But yeah, I'll have to ask about that. So notice how this wire used to be really narrow, but now you can kind of see it's starting to look like a U shape. This gap is getting a little bit bigger. I don't think that it'll be big enough for a bracket just yet. I'll probably have one more adjustment that was just normal with just changing out the wires, so it'll create more width for that tooth. This tooth has come up even more since last time, so it's almost in line with this one. It still has to, like, it has to go up just a little bit more, and it has to kind of twist. See how it's it's angled? So it's lying flatter and it needs to be kind of curved along. So still more work down there. I'm pretty sure that my rubber bands probably won't change for a while because they still have to bring these teeth up a little bit. But yeah, that's my update for week 14. Lots of progress going on. I love seeing my top teeth straighten out. I think that's so cool. I've had a lot of people ask me, oh my gosh, did your face change? Like, yeah, you can kind of tell, like my cheeks are a little bit wider, which is really cool. So I'm really looking forward to my bottom teeth also widening. Honestly, I feel like my top teeth have widened a lot more and a lot faster than my bottom teeth. So when they up the wire for my next appointment, I'm expecting a lot of pain, which is good. Pain is progress, right? So I'm expecting a lot of pain down here because hopefully it'll widen that and it'll match. So I'm really looking forward to seeing that. I will update you again tomorrow because my appointment is tomorrow. So I'll let you know how that goes and how I'm feeling, what to expect when you have braces on and you get a dental cleaning. So my first time, so I'm a little nervous. I'll be taking some ibuprofen before I go to hopefully combat the pain, hopefully. But I will see you tomorrow. Okay, so I just got back from my dental cleaning and it's freezing out here. I just wanted to make a quick video about my dental experience and whether or not it was good or bad. So I had a fairly good experience, mainly because I'm very diligent about cleaning my teeth. So pro tip, if you have braces, make sure you brush every single time you eat something, because otherwise you are more prone to cavities and decay and all that great things. So I went in and I had a couple of concerns because one of my teeth, she fixed it luckily. This tooth right here had a dark spot on it, and I discovered it probably a couple of weeks before Christmas, and I panicked. I was like, what the heck is this spot on my tooth? So she looked at it and she goes, oh, this is actually a stain. My tooth was stained, so she was able to clean it luckily, so it's nice and pretty. It used to be right there. There used to be a dark spot on my tooth. There was another one behind these two teeth, and I'm guessing it was there because these teeth have shifted. Notice how straighter they are? They used to be kind of, I don't know how to describe it. The middle part was a little bit lower, so they're finally straightening out, and there was a stain behind there, and I asked her, okay, well, what causes these stains? And she said, well, most people, when they're eating smoothies, you know, little tiny bits get stained there, or berries is another one. She mentioned salads, greens, leafy greens could get stuck or stain your teeth. So I thought that was interesting, and most of that can be avoided with brushing regularly and everything. And a lot of people use toothpaste with whitening in it, so that helps too. However, I've been avoiding toothpaste with whitening because if I use toothpaste with whitening while having braces on my face, I will get these little squares on my teeth, and I don't want that. So I've been avoiding whitening toothpaste. I've been getting just regular tartar and cavity fighting toothpaste without any added whitening. That might have been another reason why I discovered it, because the whitening helps with stains. So I thought that was very interesting. So all in all, great experience. I did take 4 ibuprofen before I left this morning, so that was probably a good thing. Otherwise, I think it would have been a little bit more painful. A lot of the plaque buildup was back here, which luckily they cleaned it up, mainly because my teeth have moved forward, so a lot of my gums have shifted, and so a bunch of plaque has built up there, and she said that's normal. However, always this clump right here will be a little harder to clean, so luckily I'm using the right toothbrush. I have an electric Oral-B toothbrush. If you want to know what materials that I'm using to clean my teeth, I will make a small list down in the description box for you so that you have an idea of what I'm using. It was a good experience. So currently I'm not in pain, but mainly because I took some ibuprofen before I left. So I am anticipating, especially down here, a lot of gum pain. So I will hopefully take some more ibuprofen later on today and to kind of combat that. So good experience, great place. My teeth are so much better. I hate feeling the plaque on the back of my teeth, especially when I can't really do anything about it. So lots of good. I got an A+ today for my teeth. They told me to keep it up, keep using the water pick, keep brushing after every meal, and I should be good to go. So no cavities, great gums. I am looking splendid. Yay! That's the best thing when you go in to get your dental cleaning and no cavities, nothing bad, no disease, nothing. So good. Okay, so I will see you in 2 more weeks. Good morning. It's about 8:10 in the morning and I am in front of my orthodontist's office. This is my 3rd visit. I will probably be getting 2 more wires and probably different rubber bands. So I'm not quite sure, but that's what they told me last time. So I will see you after my appointment. This is what I look like right now. Okay, see you in a minute. Just got back from my appointment and they did change out both wires. They went up for both. So I'm wearing a thicker wire. I haven't put my rubber bands in. So what I'm going to switch them out for, I was wearing the owls. And now they gave me boxes, which is a little bit of a thicker wire. So I'm going to actually put those on right now and then I'll show you. Okay, here's the thicker wires. I can definitely tell they're thicker because I'm having a little bit of a hard time opening my mouth, which is actually, that's expected. So they put in another spring to open this gap. They called it engaging the spring, so they're basically just pushing my 2 teeth apart, so this can come in hopefully soon. They didn't tell me the exact time I will have that tooth brought forward, but I'm hoping it's really soon. So with how my mouth is, my tongue tends to go forward, which I've been working on. Hopefully it's getting better. So when your tongue is at rest, it's supposed to rest behind your front teeth. And sometimes mine doesn't. Mine tends to go like that. But here's the thing. My mouth has had this gap in the front for most of my adult life, so my tongue naturally moved to the front. So I have to kind of bring it back a little bit. And I'm hoping that with this new wire that it will create more space for my tongue to rest. So my top teeth have widened quite a bit. 4 months in, and still a lot of work to be done. You can tell this tooth has moved up a little bit more, but I'm guessing that with this bracket it's just gonna straighten out once these teeth move out. I don't know, we'll see. But I'll do another update in a couple of days and then I'll show you what my teeth look like. So I'll see you in a couple of days. Here's the top. And the bottom. And this is what my mouth looks like closed. Okay, so I had an adjustment 2 days ago and wow, it took me a couple of days to recover from that. The initial wire changing wasn't too bad. I was actually, I was surprised that it wasn't as painful as a last adjustment. So what they did was they upped my wire, top and bottom, and they put a new spring in. I noticed that this spring is definitely the longest one that's been on my teeth, so I'm hoping to have more space in between these teeth. And my husband, he looked at my smile one day and he goes, "Your cluster seems to be declustering." I'm like, "Really?" And I looked at it and I'm like, "Yeah, you're right." It's starting to look less and less like a teeth cluster and more like an actual line, which is cool. That's what I'm most looking forward to, is having all my teeth in a row where they're supposed to be. I did speak with the orthodontist and he told me that possibly my next adjustment, I might get a bracket on that tooth. It's still a maybe. It really depends on how much my teeth move this time. I'm pretty sure I'm gonna have x-rays next time to see where everything is, but currently right now I'm just trying not to open my mouth as much because my rubber bands are a lot thicker this time, so I have to get used to that. My jaw is definitely sore from the resistance, especially my front teeth right here. There's a lot of resistance going on, so I'm having trouble speaking fast. I notice if I talk really fast, I will accidentally knock my front teeth together. Oh, it like sends a shiver down my spine because it hurts. I'm not used to having my front teeth so far forward. I almost feel like I have an underbite now, even though I look in the mirror and it's not an underbite. That's how different it feels for me because I'm not used to that at all. So hopefully my eating habits will be better. I'm hoping that in the next couple more days I'm hoping to be able to eat most of the solid foods that I was eating. Right now I'm eating more soft foods still, and it's been a couple of days and I'm still adjusting. So I haven't been able to pick up my flute. That I had a lesson 2 days ago and I was like, no, I can't do it. I can't play, it hurts so bad. So this is my update for month 4. Thank you for watching, and if you like these updates, give me a thumbs up and subscribe to my channel to check out more videos. I also do embroidery videos, and I'm working on a Cricut maker video. Yeah, I'm so excited. I got a Cricut maker for Christmas from my lovely husband and my awesome brother. So I'm super excited to open it and show you what's in the box. So look out for those videos, and thank you so much for watching. I will see you in my next one. Bye.